What is the difference between teeth whitening and a full smile makeover? Teeth whitening is a color change treatment. What does it do? It lightens natural tooth shade by breaking down stains inside enamel and dentine. What it does not fix is crooked teeth, worn edges, chips and cracks, uneven gum line, old fillings or crowns that look dark. Very dark intrinsic stain may improve but not perfectly. Now, who are these best for? For patients who like their tooth shape and alignment and just want a brighter shade. Typical result timeline: 1 session in office and 1 to 2 sessions with trays. For the maintenance, we do touch-ups every few months to yearly depending on coffee, tea, smoking and diet. So, whitening changes color, it does not change shape. Now, what is a full smile makeover? A smile makeover is a combination plan that changes multiple things, not just the shade. That can include, it can do for the whitening, composite bondings, veneers, crowns, aligners or braces, gum contouring or gum lengthening. Now, they can also replace old restorations, treatment of bite issues and wear, correction of the black triangles and uneven tooth proportions. Now, the goal of a smile makeover is to improve color, shape, symmetry, proportions, gum display and even function and bite stability. And these are best for patients who want a dramatic transformation. People with worn teeth, uneven edges, chips, people with gaps, slight crowding, asymmetry, patients with multiple old restorations or discolourations. Anyone whose smile issues are just not for shade. So, whitening is like changing the paint. A smile makeover is like changing the whole design. How long do ceramic veneers last? Most high quality ceramic veneers done with good case selection and bonding commonly last 10 to 15 years and can last longer with excellent care. What makes veneers last longer? Enamel bonding surface, proper bite design, good oral hygiene and regular cleanings. No nail biting, ice chewing, opening packets with teeth. Wearing a night guard if bruxism is present. Good margin design and healthy gums. Now, what shortens veneer lifespan is heavy grinding or clenching without protection, edge-to-edge bite, deep bite or unstable occlusion, gum disease or recession exposing margins, poor bonding protocol or under prep or over preparation cases, smoking, high inflammation, high plaque levels. Veneers can last over a decade, but your bite and habits decide whether it's 7 years or 20 years. Now, do these veneers turn yellow over time? The ceramic itself is a high quality porcelain or lithium disilicate, are high color stable and do not turn yellow the way natural enamel can. They resist staining far better than composites. What can change over time? Patients sometimes think veneers yellow because of stains in the margin. If the veneer edge is near the gum line, plaque and stains can collect around it. The veneer is not yellowing, the border area is. Now, gum recession. If gum recession happens, more natural tooth root can show. Roots are naturally darker and more yellow. This creates the illusion that the veneer has changed color. Darkening of underlying tooth or old bonding. If the tooth structure behind the veneer darkens from either aging, trauma or old composite, it can affect the final appearance, especially with more translucent veneers. Surface roughness from wear. If a veneer loses glaze due to grinding or aggressive polishing, the surface can hold stains more easily. Repolishing can often restore the look. Neighbouring teeth change color. Natural teeth can yellow with time. Veneers stay stable. So the veneers start to look whiter than the surrounding teeth, or the contrast makes the smile looks uneven. So porcelain does not really yellow. What changes is gums, edges and the teeth next to it. How patients should choose between whitening and veneers. Now you choose whitening if you like your tooth shape and alignment, you want a natural improvement, you have mild to moderate staining, you want the least invasive option, then you consider veneers or a smile makeover if the teeth are worn down, chipped, uneven, short or misshaped. There are gaps, asymmetry or mild crowding. You want a fixed, fast. Then you have intrinsic discoloration that whitening cannot handle well. You want a more predictable and controlled final look.